Assalamualaikum and hi everyone. Today our group are presenting about ultrasound. What is ultrasound? Ultrasound is known as a sonography or ultrasonography. It's a non-invasive diagnostic imaging technique. A sonogram is what an ultrasound image is referred to. Ultrasound employs high-frequency sound wave greater than 20,000 Hz that is above the audible range to produce real-time image or video of internal organ or various soft tissue, including blood vessel. Ultrasound also does not utilize radiation.
Ultrasound imaging. The US probes piezoelectric crystals exchange electrical and acoustic energy to produce the US picture, which is piezoelectric effect. The US probe emits sound waves when electrical energy is applied because piezoelectric crystals transform energy into sound energy. Sound is reflected back to the probe after reaching its target, such as tissue. Some energy is lost by absorption, scattering, and diffraction. After the probe records the reflected waves, the sound energy is transformed back into electrical energy by the piezoelectric crystals. This energy is converted into an ultrasonic image by the processor. The piezoelectric phenomenon is the transformation of electrical energy into sound energy and vice versa. The next is instrumentation. Because of their fragility, the many parts that make up as devices must be handled with care. Despite the fact that US Navy appeared to be a difficult approach to execute, it is a simple process and the majority of the devices have similar functionalities. In the sense, the likelihood of utilizing every feature of the gadget will be increased by having a true understanding of the parts and how they work. A generator, a monitor, a recorder, and a transducer are the components of a standard US gadget.
Applications. There is two types of medical ultrasound, which is diagnostic ultrasound and therapeutic ultrasound. First is diagnostic ultrasound is a non-invasive imaging method utilized to visualize internal body structure. For example, echocardiogram used to look at the heart and nearby blood vessel. It also employs to observe fetus and other abnormal organs like liver or kidney. Second is therapeutic ultrasound, employs sound wave that exceed human hearing range but does not generate image. For example, modification include shifting or applying pressure to tissue, heating tissue for precise areas in the body. Next is industrial applications. Ultrasound detect fractures in metal part utilized in the constructions of tall structure like building and bridge. High frequency sound wave can identify fracture or gaps in the substances like metal or plastic. A source of radiation is inserted into a pipe and film is wrapped around its exterior. Radiography is normally only used during manufacture or concentration due to access and safety concern.
Next is the detailed exploration of ultrasound machine. The concept of ultrasound has been around for over a century, but it truly revolutionized medicine after World War II. In 1947, the Daszak brothers pioneered visualization of the brain using ultrasound. Just a few years later, in 1949, George Ludwig used it to detect gallstones. These were groundbreaking steps. Then came the 1963s, bringing commercially available B-mode devices, creating 2D images of organs. And in 1980s, Doppler technology enabled us to see and measure blood flow. Finally, the first medical ultrasound machine was developed in Glasgow by obstetrician Ian Darnell and an engineer, Tom Brown. It was first invented in 1956 and further improved until it was perfected around 1959. Next is the components of a medical ultrasound machine. First is the control panel. This panel allows the operator to adjust settings like gain, depth, and frequency. The operator needs to change these settings to optimize the image quality. Next is the transducer or probe. This handheld device is the heart of the system. Inside, piezoelectric crystals convert electrical energy into ultrasound waves that are sent into the body. The same crystals receive the returning echoes and converting them back into the electrical signals. The footprint of the probe is the area where the waves are transmitted and received. Then is the CPU, it's the machine's brain. It coordinates everything. It receives and interprets the electrical signals from the transducer, processing them and transforming them into something we can see. And lastly is the display screen. This vital component displays a real-time visual representation of the area being scanned, allowing doctor to analyze the image and create a diagnosis. On to the next page is about modes of ultrasound imaging. First, we have A mode or amplitude mode. This is the simplest type. It displays the strength of ultrasound echoes as peaks on a graph. The x-axis shows the depth and the height of the peak represents the echo strength. It's primarily used for measuring distances. Next is B mode or brightness mode. This is the most common mode. It creates a 2D grayscale image. The brightness of each dot corresponds to the echo's strength, allowing us to visualize different tissues and organs. It's the fundamental mode used in most ultrasound examinations. Then, there's M mode or motion mode. This mode displays tissue motion over time. It captures a single line from a B mode image and graphs how the structures along that line change. It's particularly useful for evaluating moving structures like valve. And finally, we have 3D and 4D ultrasound. These modes provide enhanced visualization, particularly of a fetus during pregnancy. 3D creates a static three-dimensional image, and 4D adds the dimension of time, allowing for real-time video of fetal movement. It can be helpful in assessing fetal development. Next is about limitation of ultrasound in medicine. Firstly, ultrasound waves are significantly disrupted by air or gas. This makes it unsuitable for imaging air-filled structures like the bowel or organs obscured by it. In these cases, alternative methods like barium exams, CT scans, or MRIs are more appropriate. Secondly, imaging large patients poses a challenge. Greater amounts of tissue weaken the ultrasound waves as they travel deeper, hence reducing the image quality. And finally, ultrasound struggles to penetrate bone. It can only visualize the outer surface and not the internal structure. To visualize internal bone structures or specific joints, MRI is typically the preferred method. Next is about the example of real-world implementations in applications and uses of ultrasound in medical field. Firstly, in abdominal diagnostics, ultrasound pinpoints the source of abdominal discomfort, visualizing soft tissues and abnormalities effectively. In nephrology, ultrasound is the gold standard for kidney stone detection, accurately determining the size and quantity. Furthermore, ultrasonic lithotripsy uses focused sound waves to break down kidney stones for easier passage. For cancer detection, ultrasound elastography identifies invisible tumors. Next, in gynecology, ultrasonography is critical for evaluating female pelvic organs, detecting conditions like appendix and ovarian cysts, as well as gynecological cancer. Finally, in endocrine applications, 3D ultrasound imaging identifies thyroid and parathyroid abnormalities, such as thyroiditis.
Next, we will be talking about potential benefits of ultrasound. The first one is adaptable imaging. Ultrasounds allow us to see your soft tissues more clearly than X-rays, which are great for obtaining pictures of your bones. From monitoring factors to identifying possible issues with your bladder, ovaries, uterus, cervix, and fallopian tubes, we can do it all. Number 2. Easily accessible. Ultrasound is one of the most accessible and affordable imaging methods, in addition to being one of the most accurate. Number 3. Non-invasive. Concerned about discomfort? Fearful of needles? You are not by yourself. The good news is that there is no need for prodding or poking because ultrasonography is non-invasive. Additionally, you shouldn't experience any discomfort other than a slight pressure when we move the wand. Next is challenges in ultrasound. Increased certainty in diagnosis. The low contrast resolution of ultrasonography used to restrict its use, despite being a popular first modality due to its affordability and ease of use. Imaging with other modalities was frequently necessary for a definitive diagnosis. Ultrasound may now provide fresh insights into a variety of anatomy and applications because to the development of sophisticated imaging modes such as tissue aberration correction, spatial compounding, and harmonic imaging, which improve contrast resolution and minimize aberrations. Number 2. Increased accessibility. According to estimates from the World Health Organization (WHO), 2/3 of people worldwide do not have access to basic medical imaging technologies, which results in avoidable and occasionally fatal delays in diagnosis and treatment. Because diagnostic imaging technologies are frequently costly and fixed, and because mobility is limited and cumbersome, access is restricted for many. The subsistence farmer in a developing nation and the American veteran in a remote area face the same difficulty, imaging systems are only available in big hospitals that are far from their homes. Innovation that expands imaging to new areas could be ultrasound's greatest future contribution.
Hi, Assalamualaikum. Today I will be talking about ultrasound, specifically the challenges faced in its use and the future development that aim to overcome these issues. Okay, let's begin with the challenges of the ultrasound. First, insufficient training and education. Many healthcare professionals still don't receive enough hands-on training to operate ultrasound machines effectively, which can reduce diagnostic accuracy. Second, high initial cost of implementation. Purchasing modern ultrasound system and setting up the necessary infrastructure can be expensive, limiting access in smaller clinic or rural hospital. Third, ongoing scalability expenses. As technology evolves, upgrading and expanding ultrasound service require continuous investment. Fourth, partial restrictions. Some high-end ultrasound machines are large and need dedicated space, which may not be available in small exam rooms or mobile clinics. Fifth, operability, maintenance, and repair. Operating these machines often needs skilled personnel, and regular maintenance is necessary to ensure consistent performance. Sixth, diagnostic self-assurance and image clarity. Even with good equipment, the quality of image and the confidence of the operator in interpreting them can vary affecting diagnosis. Next, here are some promising future development in ultrasound. First, AI integration. Artificial intelligence will continue to enhance the accuracy and efficiency of ultrasound scan. AI can help detect abnormalities automatically and assist clinicians in making quicker, more precise diagnosis. Second, miniaturization. New technology is making ultrasound device smaller, lighter, and more portable. This means ultrasound can be brought to the patient's bedside or even used in remote areas with limited infrastructure. Third, telemedicine and remote imaging. With improved internet connectivity and remote control capabilities, ultrasound scan can be performed in one location and interpreted by a specialist somewhere else. This helps bring expert care to communities without on-site specialists.
Okay, next for the innovation, I have 6 suggestions for innovation. First is focused ultrasound surgery, also known as FUS. FUS uses high-intensity sound wave to destroy tumor or treat brain disorder without cutting the skin. And second is 3D and 4D ultrasound. 3D creates clearer images and 4D show real-time movement, useful in pregnancy or heart monitoring. The third one is AI-powered ultrasound. Artificial intelligence helps detect problems faster and more accurately by analyzing images automatically. 4 is portable devices. Handheld ultrasound scanner connect to smartphones, allowing scan in remote or emergency areas. Wearable ultrasound. Skin-like patches that can monitor organ or blood flow continuously, ideal for long-term patient care. And the last one is therapeutic uses, used in healing injuries, breaking kidney stone, and future drug delivery that target only certain body parts. In conclusion, ultrasound is far more than just a tool for imaging. It is a versatile, safe, and evolving technology that has made a major impact across multiple industries, from early detection of disease to monitoring pregnancy, ensuring industrial safety, and guiding minimally invasive treatment. Ultrasound technology has transformed diagnostic and therapy. With the rise of AI, portable device, and therapeutic application, ultrasound is stepping into a new era of innovation, as more accessible and more precise, benefiting not just patients but also industries, animal, and researchers around the world. In short, ultrasound is not just sound beyond hearing; it's a tool beyond boundaries.